Hello, my name is Ashley Barnes, and this is my survey of technology report. So I chose to do, let me just put my notes. I chose to do my survey of technology on the periodontal endoscopy scope. And just because I find this really interesting, I'm in the dental hygiene program, and an instructor in our program, she actually knows how to use this technology. It's not a technology that, like I guess you would say, normal hygienists are trained on using. It is a special technology that periodontal hygienists are trained in using, and so I was just interested to learn more about it. So first, I just want to talk kind of about what periodontitis is. So periodontitis is a bacterial infection of the gums, the gingiva, and also the surrounding tissue. So not only does it affect the gums, it also affects the ligaments that hold the tooth in place and the bone surrounding the tooth, and basically all the tissue and like the bone and ligaments that hold the tooth into place. That's what periodontitis affects. And like I said, it is a bacterial infection. And what happens in periodontitis is when bacteria gets into the pocket between the tooth and the gums, it creates a response from the body of an inflammatory response, and then all the white blood cells and other inflammatory cells of the body, they invade the tissue, and that is what actually causes the destruction of the tissues. That's something I have learned this past quarter, that is actually the bacteria does play a role in the disease, but it's actually the body's response to the bacteria that causes the destruction in this disease, which I find to be pretty fascinating. When the inflammatory process actually, if it gets so bad, can result in bone loss around the tooth, increased pocket depths around the sulcus of the tooth, and then if that inflammation, that bacteria is not cleaned out, it can actually lead to more loss of the bone and actually tooth loss. And just a little fact that I found, periodontitis is actually the leading cause of tooth loss among older adults in the United States. So traditionally, dental hygienists have relied on their tactile sense of using hand instruments, clinical observation when they look in like the patient's mouth, and they look at the color of the gums and if they're inflamed or if they're like bulbous or red, and they also have relied traditionally on hand instrumentation, so just regular hand scalers, which are just regular hand instruments, tools that you just use your hand to remove the bacteria and the inflammation and the calculus that has built up on the tooth. And they have also traditionally, if the patient was more periodontally involved, then a lot of times they would have to do surgery where they would actually cut a flap of gum tissue to remove from the tooth so that they could get into where the inflammation, the bacteria was, clean that out, and then put the gum tissue back and stitch it. So if you were a patient who was really involved periodontally, had deep pockets, had a lot of bacteria, basically the disease was just really festering, then you pretty much had to do surgery. And it's expensive, and nobody really wants to go through surgery. So those are traditionally the two treatments for periodontal disease, gingivitis and periodontitis. And with the relying on the hand instruments in the tactile sense, it is effective, but it's more effective for removing calculus and deposits that are in like more shallow pockets. So a healthy A healthy pocket, we want to be between 1 to 3 millimeters. And anything above that, a 4 or above, you're getting into some inflammation and you're losing some tissue, you're losing some attachment to the tooth. And then as you go deeper and deeper, you're losing bone. So that hand instrumentation and relying on your tactile sense, that's more effective in the more shallow pockets, the 1 to 3, 1 to 4 pocket range. So when you get into dealing with patients that have deeper pockets, like 8 millimeters, 9, 10, 11, even sometimes up to 16, it becomes really difficult to know exactly where you are removing the calculus, removing the bacteria, and then being able to go back and detect if you did remove it. It's more difficult to feel that on the root surface. It's much easier to detect a smooth surface after you have removed the deposits on the crown of the tooth than on the root of the tooth. So that is where the periodontal scope has come into play and has proved to be really successful and a great treatment for patients who are really involved. So the periodontal endoscope was originally created by a company called Dental View Incorporated, and it's currently available from Perioscope Incorporated, and it's commonly known as the Perioscope. That comes from their name, and that's how most of the dental professionals will know it as, is the Perioscope. And basically some more information about that, what the Perioscope is, it's a mini, let me get my notes back. Okay, so it's a really small mini 10,000 pixel camera that can magnify the inflammation, the bacteria, the calculus 24 to 48 times. And the camera goes into the pocket of the tooth, and then the camera, the image shows up on a monitor screen that is by the hygienist. And so they're actually, when they're providing the treatment, they're actually not looking into the patient's mouth, they're looking up at the screen. So that's why it takes a lot of skill and a lot of training, because you're using both your hands, both your feet to do the pedals and to make it work, and then you're actually looking at a computer monitor screen to know where you're going. So it's a lot different than what traditional hygienists are, of what they're trained to do, but it has proved to be successful. So like I said, it does magnify the inflammation and the calculus in the deep pocket 24 to 48 times. Sorry. And then the clinician is able to accurately see the deposits, the calculus, the inflammation, and they're able to remove it with an ultrasonic instrument. And an ultrasonic instrument is a powered instrument that vibrates and uses water to remove the deposits. Okay, so like I was talking about, this is really ideal for, the Perioscope is really ideal for those patients that have deep pockets. So because the clinician is actually able to visualize and they can see what is there, and they can see when they have removed it. And so it's a really effective treatment because you're 100% certain that you have removed the bacteria, you've removed the deposits, and you're not questioning, is that what I'm feeling? There's no questioning involved, because you can see it. And also, this treatment is a step above than what traditionally has been done, because it's non-invasive. And traditionally, where these patients who were involved would have to do surgery, now they can have this non-invasive therapy that can be done in the office. And the results are showing to be just as great as if you had surgery. So I did come across in my studies a case study that I wanted to talk about that I thought was pretty, it just illustrates how great this technology is. So a 43-year-old female, she presented to a clinic with 10 millimeter pockets on the buccal side of her tooth, so like on the side that is like towards her cheek. And then a 12 millimeter pocket on the lingual side, so that'd be like on the inside by her tongue. and that was on her lower right molar, and it had been there for about 1 year before she went into the office that she went into. So this patient, she had previous negative experiences with dental work when she had her wisdom teeth removed, and so she opted to kind of go with just the traditional treatment at first. She wanted something that she was more comfortable with. So what the hygienist did at first was they just got her numb in that area, and then they just used the hand instruments to go in and to try and remove the deposits, trying to remove the calculus and the infection that was in that pocket. So after that treatment was performed, she came back for a checkup, and her 10 millimeter and 12 millimeter pockets had improved. They had improved by 4 to 6 millimeters reduction in the original pocket depths. And so that was great, but they still had some treatment that they needed to do, because ideally you want to get your patient back to 2 to 3 millimeters by molars. That's the pockets that you want for a patient who has healthy gums. And so that's where the treatment was going. They wanted to improve even more. So the patient decided that she would try the Perioscope, the periodontal endoscopy treatment. And so the clinician went ahead and did that treatment. It was completed, and the patient came in for a 6-month post-op checkup. And at that checkup, 6 months post the treatment, the patient presented with 2 to 3 millimeter pockets. So exactly where we wanted the patient to be, which is pretty amazing. And after that, the patient, I think the case study went back, followed her for 8 years. And so up to that 8 years, she still had remarkable success. She kept those 2 to 3 millimeter pockets, and she didn't have further bone loss. Granted, with periodontitis, it is non-reversible. The patient will always have this disease. We can't, as clinicians, we cannot reverse it, but we can manage it. And so in this case, she had her disease managed, and with regular checkups, 4 to 6, depending on if her clinician wanted to see her every 4 months or every 6 months, they would give her a thorough cleaning and manage those pockets to where they can stay between 2 to 3 millimeters and not progress to that 10 millimeter pocket that she did have before. So her treatment was incredible, showed incredible success, and this is what we have seen with other case studies with this treatment with the Perioscope, is that it has remarkable results, because the clinician is able to see where they're working, they're able to see the calculus, see the inflammation, and they're able to completely remove it because they can see it, and then they can see that it's gone. And so I just find that fascinating, and I just think that this technology is so important to the dental field, and especially to the dental hygienist who's interested in learning this technology, because it is an advanced technology and it does require advanced learning. I think it's so important because it allows you as a clinician to have a better view of the area that you're treating, and by doing that, you're able to better treat your patients. You're better able to give them the treatment they deserve and the outcome that they deserve, and overall the outcomes are going to be better, and people are going to have a greater oral health, which we know leads to a greater overall systemic health. So this is definitely a wonderful advancement that that technology has proved to do in the dental field, and I really found it interesting to learn about it.